Assalamu alaikum. I hope that you guys are doing well. So today the topic that I'm going to discuss with you people is spinal cord. So before studying about spinal cord, you should know the three basic things that in adults, not in children, in adults. I'm talking about adults. The spinal cord ends at L1, L2 vertebra. The second point to memorize is subarachnoid space. Double S in subarachnoid space, S and S, so S2 vertebra. It extends to the lower border of S2 vertebra, and it is the area which contains the CSF, the cerebrospinal fluid. Then the lumbar puncture is done after the area where the spinal cord ends, which means that after L1 and L2, there is L3 and L4, L4 or L5. So after L2, that would be your area to do lumbar puncture. That would be L3, L4 or L4 or L5, just beneath L2. Then you should remember the 9 different structures which the needle is going to pierce to give epidural anesthesia or to give to get the CSF fluid. So you should know that when you are piercing the back of the patient, then which structures are being pierced. So number one is skin. Then okay, so just see the right part of the screen over here. This is the skin, this is the fascia or fat which is insulating the different structures. Then we have supraspinous ligament. We are saying as supraspinous because these are the spinous processes. So it is supraspinous ligament. Then between the spinous processes are the interspinous ligament. Then this is ligamentum flavum. Then this is this blue one, epidural space. Then pink one is dural matter or dura matter. Then this green one is arachnoid matter, and then this one is the subarachnoid space. And here the point number 6 is epidural space. So if you are giving epidural anesthesia, then your needle stops here, you are not going to go beneath it. But if CSF fluid is to be collected, then this would be the area. Okay, you should also know about the anterior longitudinal ligament. This is the posterior longitudinal ligament. And okay, so this one is the conus medullaris. Okay, so conus medullaris is basically the terminal end of the spinal cord, so which is at the level of L1, so it ends over here. Your spinal cord basically ends between L1 or L2, so this is going to be the conus medullaris. Then this one over here is the cauda equina, just like the tail of the horse. So cauda equina is basically the roots of lumbar and sacral spinal nerves, which form a bundle within the lowest part of the spinal column. So spinal cord ends, but this is a column now, so it is the lowest most a part of the spinal column, so that would be the cauda equina. And this one over here is the filum terminale, so it is basically the non-functional continuation of the end of the spinal cord, and it basically consists of fibrous tissue without any functional nervous tissue, so it is actually non-functional. So this is filum terminale, so it is terminating, terminale is terminating. So I hope you have understood this concept. So if you have, then do recommend my channel, subscribe,